How should looking after yourself vary between ethnic backgrounds? What is your current workout split? What is your opinion on Hyrax training? And what is the best part of your current job? So I put out a poll on social media for people to ask me questions relating to health, fitness, medicine, and obviously a few people have put in questions that are personal to me as well. So I thought I'd go through them, answer them in this video, and hopefully give some insights that you may not be aware of. So I've just compiled these together now. So these are in no particular order, but the one that caught my eye straight away was, how should looking after yourself vary between ethnic backgrounds? In reality, the core principles remain the same. So reduce the amount of ultra-processed food that you eat, increase the amount of movement that you can do, try and build muscle mass, make sure you have adequate levels of sleep, make sure the quality is good enough, reduce the amount of stress. So as an overall thing, everything remains constant. But the one thing that I would say is that when you look at BMI, I know it gets a lot of bad reputation, but when you look at the classic cutoffs, 25 and above being overweight, 30 and above being obese, these are mainly relating to white individuals, white males actually, because the studies that I remember looking at weren't done in females. And if you look at anyone with an ethnic background, so these may be Asian, Afro-Caribbean, Middle Eastern, you reduce the values. So obese is no longer 30, it's 27.5. And the reason being is that these people or these cohorts are more susceptible to metabolic dysfunction. And that's because they deposit their fat more viscerally, so not as an aesthetic subcutaneous compartment, but they do it around organs and within compartments that we don't really want fat to be. So people within this cohort are more sensitive to metabolic dysfunction, one of them being type 2 diabetes, and that's the first one that comes to mind. So the only way that I would approach health and well-being differently if you are of this ethnic descent is that I would have a stricter approach to body fat percentage. I would have that as low as possible because a lot of people, especially South Asian, so you've got Bengalis, you've got Indians, where they have high risk of type 2 diabetes because they want to store their fat, or necessarily they don't want to, but their body stores their fat within the liver, pancreas, and all these other places. So I wouldn't change what you do as a whole, but I would change your body fat percentage cutoffs. I would try and be as low as possible and always keep an eye out for metabolic dysfunction in the form of diabetes. The second one, what is my current workout split? So my training has changed drastically. So at the moment I do 4 weightlifting sessions a week. So I'll split them into 2 upper days, 2 lower days. I then split the lower days into quad dominance for one day and hamstring dominant the other. Now I actually did a workout yesterday from when I'm filming this, and I haven't done squatting for a long time. Really good form, and then just had a back spasm. So as I'm recording this now, I am in a bit of pain, but that's what I do for weightlifting side of things. And then with cardio, I aim for zone 2, about 2 and a bit hours a week. I try and do VO2 max training probably once a week. The only thing that I am poor at, and I keep saying it consistently, is the mobility and yoga aspect. I've been doing probably 1 session a week. I don't have any rest days. That is something I used to have, and it's because I've toned down the intensity of my training. I think it's more beneficial to train every single day, making sure that your body is moving on a daily basis, as opposed to going all out and then having a day of rest in between, because I'm not competing for anything. I am merely exercising for health and just to improve longevity and quality of life into my later years. So I just think moving every single day is better than having all out one day and rest the other day. So that's my current workout split. The next question is, if I'm on the fence, how do I decide if blood testing is for me? So blood testing, I actually should have included this into the pillars of health and wellness anyway. I think blood testing or any form of testing, whether it be VO2 max, body fat percentage, DEXA scans, I think testing should form a large proportion of people's health and wellness journeys, because like I keep going on about multiple times on this channel, is that you can look a certain way on the outside, but it doesn't tell you anything that's going on the inside. So the only way to know that is by testing. Blood testing is quite accessible and you get a lot of information back from that. Can you use it in isolation? No, and I wouldn't recommend using anything in isolation because everything needs to be contextualized. But blood testing is the only way that you're truly going to know what's happening in terms of biomarkers within the body. So for cardiovascular risk, whether that be cholesterol, whether that be lipoprotein A for genetic cardiac markers, whether it be for metabolic function, so insulin resistance, HbA1c for diabetes. The only way you know this, vitamins, minerals, obviously they're more popularized because people feel as though they can act on that sooner and feel the benefit from it. But if you are on the fence with regards to blood testing, I think you need to include it if you really want to optimize your health and know what's going on within the body. The next question is, are there any supplements you think everyone should take? Now, in terms of supplementation, I only take omega-3, and the only reason being is that I did do a blood test for my omega-3 index. It should be between 8 and 12%, and I consider myself to have a really good diet. I have mackerel on average 1 to 2 times a week, salmon probably 2 to 3 times a week, so I was getting enough of these omega-3 fatty fishes that I thought would be enough for my diet going forward. And in reality, my index come back, and I want to say it was 4.1%, or I think it was actually just below 4%, so that put me at a high risk of cardiovascular disease or complications if I were to develop it. So I use this. I'm going to retest in about a month's time, because you have to test every 120 days. Once you are in the initial phase, once it's stable, then you don't really need to test, and that's because we're testing what it's incorporated within the red blood cell. But anyway, that's a supplement I feel as though if this comes back as a good result, that is worth taking, because clearly it's not adequate enough for my diet. Creatine gets a lot of hype at the moment. I do feel as though it does have a lot of benefits from a functional perspective. However, creatine is best used when you are doing explosive activities. I don't think it has the same benefit for endurance athletes, because you are not requiring a quick release of energy, whereas in explosive sports, whether that be powerlifting, even going to the gym and doing PR lifts, that's where creatine comes in and is really beneficial to people's lifestyle. There are a lot of studies growing in the aspect of looking at brain function and brain health, and creatine is showing positive benefits at this moment in time. I don't personally use creatine at the moment, and I feel that I want to research it more before I do so. Like I said, it seems very positive. It looks like it is the most researched supplement out there, but there's still a few things that I would like to tick off before I start using it on a daily basis, and whether it is a worthwhile investment to do. But if you are using it, make sure that it is a monohydrate, make sure that it's not bound with all these other fillers and other products that don't really add any beneficial impact to your health. With regards to other supplements, protein, I don't personally use protein supplements. I'm always on the fence with this because a lot of them are ultra processed, and it's one of them things, if you need it for your lifestyle in terms of you're an athlete or you just cannot fit that protein in, then I do think it's beneficial to make sure you hit your protein target. But if you're merely having it because of the marketing pressures and you feel as though you just want the ease and convenience over using whole food, then I disagree with you using it there. You should go for the whole food approach first, because you will have many benefits from the actual complete diet, as opposed to just supplementing protein and adding all these extra chemicals within your lifestyle. Other supplements are not regulated, and that's why it's quite hard to advise on these. I feel like a lot of companies are capitalizing on the supplement industry. They are using people who are in really good physical health, they have got really good physical function, and if they're taking it, surely it must give you the desired outcome. But in reality, it is just merely capitalistic, and the evidence to support these, like I said, there's minimal robust studies out there. What is my opinion on Hyrax training? Now, I don't want this to get confused with me being negative towards it. I feel as though Hyrax as an event, as a motivation, is really good. It gives people some sort of purpose that may have never had a purpose to exercise in the first place. So I feel as though that is highly beneficial. The only thing that I had against Hyrax training was that a lot of people who hadn't been exercising have gone from not doing anything at all to a very, very intense activity in sport. And then will that put them off psychologically going forward? Again, it's one of them things. There is no right answer. So if it does you the world of good, it's mentally stimulating, then by all means continue with it. If you feel as though you are going to fall out of love with it and you're not going to be training past 16 weeks, 20 weeks, then knock it on the head, go and do something that you are going to continue for 10, 15, 20 years. And that's my only gripe with Hyrax, is that I feel as though it is that grueling that people maybe put off long-term exercise. The next one is, what is the best part of your job as a pharmacist? Now, if I'm being honest, I feel as though I've lost all passion for pharmacy. When I first went into the job, I felt as though there was a lot of things to try and prove. It was really interesting because the science is there. There's a lot of logic to certain biological systems. And seeing a patient come in with really poor health and then treating them within a hospital setting to then go out the door and basically be fully functional again, was a really good thing to do, and it was quite motivating at one point. But now, the more and more I've gone into preventative health, the science, the politics, a lot of other things that are going on in the world, I feel as though my passions come away from that, and I would like to push this idea of longevity and preventative health. But I'm not going to lie, I am finding it quite difficult because of the reception on both the health sector side and also the public side. On the health systems part, they are heavily led by guidelines, and there's a lot of medical legal stuff that are involved. So like I always say, if a patient turns up at 50 years old, they are overweight, they are smoking, they're drinking a lot of alcohol, they've got chest pain, you don't really have the time to send them away to go and start a gym routine, to reduce ultra processed food, to reduce smoking, to reduce drinking, because ideally within the next 3 months they're probably going to have a heart attack of some description. So that's why you need to act quick. You need to give trusted pharmacotherapy, because you know then that they are going to be safe, they're probably going to survive and have a normal quality of life going forward. Is it going to be optimal? No. And are there ways that we can do it differently? Of course it is. But that's the issue coming from a health point of view. And from the public's point of view, you have two different camps. You've got the one camp where they don't want to take any medication, which is fair enough. But then when it suits a lot of the public, so with these GLP-1 medications, they will quickly jump on that bandwagon. So that's quite a hard demographic to deal with. And on the other side, you will have people who are heavily reliant on medication, but will then not have other medication because they feel as though that will be doing them harm. So there's never an easy consultation. There is never an easy path, whether that be discussing with people within the health sector or within the public. So that is why I'm finding it very challenging to push preventative health. And that is what I want for everyone. I want everyone to feel as though they have a high quality of life, it is highly optimized, and they have autonomy over their health, and they understand fully what's going on with their health. So that's why I've started to build up a YouTube channel. That's why I'm doing a community. That's why I've done all these other things to try and build the job and the career that I actually would have a big passion for, and it would be helping people improve their health going forwards. Now I'm going to finish on a personal question, which was, what do you enjoy doing outside of your job? So I'm quite a simple person really. I like going for walks, I like having a nice coffee, I like going to the gym, pushing myself in that way. I always like to stay active, whether that be mentally active. I can't sit there and just do nothing at rest. I just find that really boring to me. A lot of things that I used to find interest in, I have slowly come away from whilst I'm trying to build other things, but going to watch the footy, that was a big thing that I really enjoyed doing. Probably fell out of love with it over recent months, definitely over the last year. I would go everywhere to sort of watch Liverpool play, home, away. I would go to European games. But because of the way that you see the economy and other politics coming into it, I just find it hard to have that same passion anymore when you're watching these men on a pitch who don't have the same passion that other people in the terraces are having. But aside from that, I love to go traveling. So I like going to all these, I love Asia. I need to travel to Asia a bit more. I've only done a couple of countries in Asia. I do like America, even though at the moment it can be quite volatile, but we were brought up by going to America quite a lot. I was fortunate in that way. So traveling, having a nice coffee, walking, staying active and having a bit of a purpose. That's what I like to do outside. And I do love good food, which is a bit of a problem now because one, I'm lactose intolerant, and two, we're putting more money in towards the business aspect. So to try and go for a really high Michelin meal or wherever it is quite hard to put that disposable income aside to go on them ventures. Now I actually got more questions than what I thought, so thanks for anyone who asked them. I will be covering the rest of them probably in a live next week, and the idea is that if anyone does want me to do any of these again, a Q&A, comment below, reach out to me. I'll probably do another poll on Instagram at some point. These are just all ideas for me to slowly build up YouTube, see what people are wanting me to do videos on, because that is quite a hard thing, trying to tailor your content towards the audience. But if you've got this far, thanks for watching, and I will see you in the next one.